over their lifetime. The commonest ones that are used are for the pain, for the bladder and bowel dysfunction, and fatigue and spasticity, and but with regards to that, those majority of those, we don't have anything new happening. So the only new medication which is available, luckily, for the patients in Wales, and we finally, thankfully, thanks very much to the Jenny Duffy, who is also here today on the call. She really was doing very hard work to make this happen. So we have recently started offering this treatment for our Welsh patients, but again, unfortunately, there is a limited capacity, and so we are slowly getting there. The Sativex is relatively new, but not as new for the Welsh patients. We've been using that for the last couple of years. However, the patients based on England sites, I know that there are quite a few Welsh patients who are attending the clinics in England, and they were not able to get Sativex treatment on those sites and had to be referred back to the Welsh sites. Now they can access this treatment also if they have clinic appointments in other MS clinics other than Clonclwyd. Then with regards to the symptom management, also important to mention now is the relapse management, because the patient with secondary progressive MS can also have relapses, although not as often as during the early stage and the relapsing remitting course, but the relapses can happen and they can occur. However, it's very important to note that particularly in progressive MS patients, because they have already accumulated the disability from many symptoms that they have experienced over the time, and they have increased risk of infection. For instance, the bladder infections are very common. So it's very important every time when you notice any more rapid worsening of the symptoms or developing a new neurological symptoms in progressive MS, it's always important to first look for infections, because as Dr. Pomeroy already showed in another slide, there are relapses, but then there are also the recapitulations, and those we often see more in progressive patients than the relapses themselves, although the relapses can still occur. The steroids can be used if there are significant, if the new symptoms are significant and significantly affecting the daily living and various aspects. However, we've been more cautious prescribing the steroids in the current pandemic because there have been quite a few studies showing that the patients on the high dose steroids might develop more severe COVID. So usually we recommend the shielding or avoiding the contact with possible positive cases. So, however, currently with the vaccinations, we hope that that will help, that we encourage our MS patients to get vaccinated. So the safety is also a concerning aspect with some new immunomodulators, the ocrelizumab and siponimab, because they target the immune cells. And if in the past we were not that much worried because we didn't have that many dangerous infections, and majority like zoster infection could be prevented with vaccination, or hepatitis vaccinations could be given. But now we are in the middle, still in the middle of the pandemic, and yeah, there are some concerns that the treatment might reduce the vaccination efficacy. And I know that some of the patients from Wales were asking and were not very happy that we had to hold ocrelizumab treatment for progressive patients for some time, but we did that in line with the national guidelines. There was the group of MS experts from across the country who came together despite their busyness, and they looked through the literature evidence and other data that we had historically to help clinicians and the patients to make the right choices and the right decisions. And we follow the same principles. Now that we have much more understanding and we have a treatment available if somebody develops more severe COVID, so now we are giving these treatments again. But again, capacity, unfortunately, is reduced because of other additional requirements which we have to apply. From the symptomatic management, I mentioned Sativex. Sativex, many patients, interesting enough, even if the Sativex has been available for the last couple of years in North Wales, but often in the clinics, when I mention the medication for the patients that I think which might benefit, they actually have never heard about that. So I think in a MS patient community, it might still be relatively new, although there are some aspects around of that. And the Sativex is a cannabis-based medication, and not many would feel that this is the group of medication that we would like to consider, but yeah, it is a good option for spasticity management for the proportion of the patients who have not been able to show benefit or tolerate some other more commonly used medications. But again, this would be that the medication cannot be prescribed by the GPs. GPs haven't agreed to take over prescriptions. So again, there are some limited resources with that, but also the medication has more like a national limitations. So through the controlling bodies, because there has more strict inclusion criteria. So the patient has to have assessment and has to demonstrate the failure from the previous medications too. And there are some concerns, mainly about the cognitive side effects, which unfortunately can happen, including something as severe as psychosis. It's not as often, we don't see that many cases of severe cognitive side effects, but they can occur, especially in the patients with already prior cognitive dysfunction. So we are very careful of when and to whom we offer the treatment. The famprogene is relatively safe medication. It doesn't, and it relatively safe, but at the same time, it might cause issues in a proportion of the patient, particularly those with the underlying heart disease or the patients with a history of the seizures. It can increase risk of falls, and as we already know, the patients, particularly those with progressive MS, already have increased risk of falls. So you would be very careful offering the medication which can increase the falls, but to my understanding, it's more associated with the side effect profile because it often can cause dizziness. And if you have dizziness off top of already the other difficulties, that might just become more difficult. The drug is used as a tablet form twice a day and it works by blocking a certain the channels called potassium channels on the surface of the nerve and of the nerve fibers, and then in that way it's improving conduction of the nerve signals within the nerve fibers which are damaged by MS, and it can improve the walking speed. But again, it's only about 50% of patients respond to the treatment. The ones who do, they find it as a life-changing. So if I have a little bit